Before I bring in a friend, Letty Garza from News Channel 5, let me ask Dr. Christopher Wood, joining me from MD Anderson in Houston. Dr. Wood, what is renal cell carcinoma papillary cancer?
Papillary kidney cancer it's a type of kidney cancer basically, and papillary type is actually one of the more rare forms of kidney cancer that we find. There are several different types of kidney cancer. The most common is clear cell, but in this case, Letty has papillary type.
We want to thank you for helping Letty Garza fight this. Letty, when did you find out? How did you find out you had this type of cancer?
Well, it was in early December when my daughter and I decided to go into clean eating mode, and we ate pretty clean for a couple of weeks, and then I broke down like most people do when they're on crazy diets. I decided to have a greasy meal, and I got ill on Saturday night, and I got ill to my stomach. And then I had a low-grade fever on Saturday. My left side was hurting. Come Sunday, I was still not feeling well, and then Monday morning I woke up with a fever as well. So I went to my doctor, and Dr. Noel Lopez told me that he's our general practitioner, and he said that, you know what, let's play it safe. Let's get an ultrasound, and let's just make sure you're okay. So I went for the ultrasound, and sure enough, they found a suspicious spot in my left kidney. So then after that, of course, the radiologist suggested I do a CT scan. And after that, it was the CT scan with the dye. And that's when they referred me over to a local urologist. And that local urologist met with my husband and I, who told me those horrible words, "You have cancer." So at that point in time, we decided to get a second opinion because when you're told you have cancer, you're afraid, you're scared. And I was, at first you're kind of in denial. You're like, what is happening here? Is this really happening to me? But then you kind of go into survival mode, and I told myself, I've heard a lot of wonderful things about MD Anderson. So sure enough, I made a call. I got in right away. Thank God. And next thing I know, I'm meeting Dr. Wood and his fantastic team at MD Anderson.
Dr. Wood, how serious, how treatable is this type of cancer, this kidney cancer, this papillary cancer that's specific to Letty?
Well, in her specific case, the tumor appeared to be confined to the kidney. There was no obvious evidence of any spread or metastasis, so it's very readily treatable with surgical resection, which is what we did.
Is there anything that she may have done that kick-started? Letty mentioned the clean eating thing that she went through. Anything lifestyle-related that creates this?
Well, there certainly are things in our lifestyle that are linked to kidney cancer, smoking being probably the most common one, but there are a variety of different things, both in our diets as well as in the environment, that have been linked to kidney cancer. But in a specific case, it's really impossible to tell what exactly was the causative factor.
Now, Letty, you said that you got really sick. You've been on a diet. You've been doing some clean eating. I mean, there's no connection between that and the cancer. I mean, did you get sick as a result of the clean eating thing, or did you get sick because of the cancer?
No. I really think it was just the fact that I hadn't eaten anything greasy for several weeks. And I think, when you eat something greasy, all of a sudden your body rejects it.
Yeah.
And my body rejected it. So I don't really think, I do know, and I don't know if Dr. Wood will agree with me, but before my surgery, I was tired. I was very exhausted, always.
For how long would you say, Letty, were you like that?
I would say a year or two. I just didn't feel well. I always felt like I had a low-grade fever. And then I feel fabulous now. I don't know if it's a placebo effect, but I feel so much better, Dr. Wood. I really do. And my viewers, I want y'all to know I feel so much better. I sleep better. I don't know. I'm not sure if it was because of the full nephrectomy that I had. My entire kidney was taken out.
Wow.
And I feel fantastic. I really do.
Thank God he gave us two. Dr. Wood, how long does this grow? Is it a slow growing cancer? Is it a fast growing cancer, this kidney cancer?
There are different types, and in her particular case, I'm not sure that we can ever understand how fast it took for this tumor to grow.
Okay.
Kidney cancers don't grow at a linear rate either. Sometimes they'll grow for a bit and then stop, and then grow for a bit and then stop. So she's probably had that tumor for on the order of years.
Wow.
With regards to her symptoms, kidney cancers are notorious for what are called paraneoplastic syndromes, and basically what that means is that the kidney tumor secretes hormones that cause side effects elsewhere in the body. So it's possible that some of her symptoms may have been related to the tumor, and it's possible that by removing the tumor, those symptoms have gone away.
So what now, Letty? Where are you in this journey?
Well, Dr. Wood has recommended that I come in every 6 months for 2 years to get a CAT scan to make sure that I'm cancer-free. I do have a 20% chance of the cancer coming back, but I have a lot of faith that it's not going to come back. I'm just so happy that I'm cancer-free. I'm thankful to, my local general practitioner, Dr. Lopez. Thankful to MD Anderson, obviously Dr. Christopher Wood and his wonderful team, Dr. Meisner, Dr. Innocent. Like I mentioned to you before, Sergio, MD Anderson has an incredible staff, all the way from diagnostics to imaging, and of course the surgical staff and the incredible Dr. Wood, who put me so much at ease. They are a fantastic group, and they cured me. I'm cured, and I also want to thank my family, my husband, Ray Garza, and my daughter. They babied me throughout the whole thing, and the whole valley has been very supportive. I've gotten so many messages, and the power of prayer really does work. I have to point that out because so many people, literally thousands and thousands of people prayed for me, and I'm so grateful for that.
I'll tell you one item that you missed on the thank you list, Letty. You're missing either the greasy pizza or the tamales or the carne guisada. I don't know what you ate. It was some cheeseburgers. Okay, that's what made you sick. Sent you to the doctor, and one thing led to the other just to make sure.
Dr. Wood knows, but he knows I can't say anything on the air.
But it just happened to be really by accident that she found this cancer, right, Dr. Wood?
Yeah, it was. And in fact, most of the patients that I see nowadays have a very similar story where they present with some nonspecific complaint and somebody gets an imaging study and there they find a renal mass. That's a very, very common presentation.
Anything that you recommend folks do in order to address this issue with their doctor, or is it going to be like that? People will just find out by accident?
Yeah, unfortunately, screening in this situation is not cost effective, so we don't typically recommend getting ultrasounds as a screen, but people should pay attention to their body. If they have pain someplace, they should go and get it investigated, and certainly if they have blood in their urine, they definitely should go get it investigated.
Dr. Wood, thank you. That's Dr. Christopher Wood from MD Anderson, along with a friend to all of us here in the Rio Grande Valley from KRGV News Channel 5, Letty Garza. We're so happy and grateful to hear the good news, and we wish you continued health, dear friend. Thank you, Letty.
Thank you so much, Sergio. Thank you for giving me the opportunity to do your show. It's wonderful. And thank you, Dr. Wood. I want to thank you publicly for saving my life. Thank you, sir.
No, thank you for letting me be a part of this.